Welcome to the Secrets of College Planning. I'm your host, Anthony Uva, and today we're going to get some insight into becoming a dermatologist. My guest today is Dr. Daniel Groisser. He is a dermatologist, former owner of the Dermatology Group, which is now Schweiger Dermatology Group. Welcome to the show.
Thank you very much.
So usually I ask my guests, Doctor, where they went to college. So where'd you go to school?
I went to Columbia College at Columbia University in New York.
So let's just go back in time before we get into dermatology. When did you start thinking about becoming a dermatologist? Was it freshman year of high school or senior year? When did you even start thinking about going to college?
I think when I was a very young kid, my dad was a doctor, a gastroenterologist in New Jersey, a very well-respected one, and I wanted to emulate him. I liked the idea of helping people, being a doctor from like 3 or 4 or 5 years old, something very young. So I always knew I wanted to be a doctor, but I didn't know about dermatology. I thought I'd be a gastroenterologist. So I didn't make that decision until after medical school when I was in training for internal, way down the road.
So now, was Columbia your only choice, or did you have multiple choices to go to?
No, I like now it's very competitive, but Columbia was my first choice, and I loved it. It was a great college.
So now you get to Columbia. What's it like? Tell us a little bit about Columbia and how it was when you were there.
Well, I went to Columbia knowing that I wanted to go from there to medical school, and I knew that at Columbia I better work hard, get good grades, because you can go to Columbia, and if you don't do well at Columbia, you're not going to see a medical school, particularly an American medical school. And so my parents put a lot of pressure on me at the time, and I put pressure on myself. But I also knew that I wanted to have a good time at college, so I didn't major in a hard science. I majored in sociology, which I thought was interesting. I figured, and I was right, that I didn't need to take all that much science in college when I'd have so much science the rest of my life. So what I did was I was pre-med. I took the pre-med curriculum, which is basic not algebra. It's calculus, chemistry, inorganic chemistry, organic chemistry, physics, and that's about it. And the rest you can major in a social science, like I did. So I majored in sociology, was pre-med, and applied and got into medical school after college.
So now you graduate. How does one become a dermatologist after graduating from college?
Well, first you have to become a doctor, an MD. So after Columbia, I went to medical school. I went to Cornell Medical School, which is on the Upper East Side of New York at Sloan Kettering, the New York Hospital, the Rockefeller Institute, and the Hospital for Special Surgery, HSS. So I got in there, and I was thrilled to get into going to Columbia. Helped me get into medical school, and that was a great move. And so once I was in medical school, then I went on to deciding I wanted to be a gastroenterologist. So I went to, after medical school was over, to do an internal medicine residency for 3 years. So medical school's, college is 4 years, medical school is 4 years, and then I did 3 years of internal medicine training at Mount Sinai Hospital in New York, thinking I was going to be a gastroenterologist. But somewhere during my internal medicine training in the beginning, I decided I didn't want to be a gastroenterologist. I changed my mind. I wanted to do something more office space. So I decided to take a rotation in dermatology during my residency at Mount Sinai. Liked it, applied to dermatology, got in. And then after 3 years at Mount Sinai, I took my boards in internal medicine. I got them. And then I went on to dermatology at the University of Michigan in Ann Arbor. And I did 3 years of training there too.
So could you give a little synopsis to a student that's in high school, what the amount of work entailed to become a dermatologist?
I mean, it's 4 years of college, 4 years of medical school, 1 to 3 years of another residency, and then 3 years of dermatology. So if you want to add up post high school years, it's 4 for college, 4 for medical school, it's 8. And then anywhere from 4 more to 6 more years. So it's going to be 12 to 14 years after high school to get to be a dermatologist.
And a couple of exams and a couple of practices on bodies, right?
Sorry.
A couple of exams that you have to take, and then of course you have to practice on some bodies that come in. And
you get exams all the way along. You get tested all the way along. It's like anything else. Yeah.
Yeah. So when did you start the dermatology group, and where are you located, and how did you get started with it?
Well, I started by myself in Montclair, New Jersey in July of 1992. I got busy and then I built a bigger office. I brought some associates in who later became partners, and we bought some office spaces and organically grew ourselves in many locations in Riverdale, New Jersey, Morristown, New Jersey, Nutley, New Jersey. We just grew 15 offices over the next years. And I went from a 4 or 5 man office to a 400 person office with the back office and all the different C-suite positions and CEO and chief operating officers and blah blah blah. And then we sold to private equity at that point.
Gotcha. Now I'm also a patient of yours, so I saw in the lobby area that you've been recognized from different organizations as well.
Yeah, every year New Jersey Monthly tries to recognize who they think are the top doctors by asking all the doctors, not just dermatologists, to vote for each other. And I've been and there's about 400 dermatologists, 350 to 400 dermatologists in New Jersey, and I've been voted in the top 10 for the last 13 or 14 years.
Now, what goes into being a dermatologist? What are you actually looking at when you look at people's bodies?
Well, a dermatologist sees anything. We take care of anything that you can see, touch, feel, with the exception of the eyeballs. That's for eye doctors, and the teeth. That's for dentists. But we do lumps and bumps. We do benign lesions. We do malignancies, pre-malignancies. We do acne. We do eczema. Anything that touches the skin.
And how do people find you?
I mean, to get to me, they can Google me, Daniel Groisser, and dermatology, and they'll see that I'm part of something called the Schweiger Group, or they could Google Schweiger Dermatology.
Go ahead.
And I happen to be located in our Nutley office now.
Now, if you're a student, do you have internships there? Do you have anything where college students are coming to you?
We used to be able to do that, but now with HIPAA guidelines, we can't. So no, we really don't have people coming in off the street or watching. We do have some. We train a lot of not doctors, but physicians, assistants, and nurse practitioners, and they join us, and so we train them. We have a big training program.
And that's also a few years as well?
It takes about 2 years to become a nurse practitioner and or a physician's assistant, and then they come train with us for a good year. I mean, honestly, even now I'm learning. We're always trained. Doctors are always training.
And they're always picking up different things, learning about different things? Always
learn. There's always, look, if you don't stay awake, you get left behind, because the medications I use now, I was not using 5 or 10 years ago.
And what do you see as the most common skin dermatologist skin problem that's coming in?
I mean, I would say the vast majority are acne, eczema, warts, skin cancer, basal cells, squamous cells, melanomas, psoriasis, folliculitis. That's the majority of stuff. I mean, we see thousands of different diagnoses, but those are the common ones.
Yeah. So, and people that are coming to you, is that something where you want to see people on a regular basis?
Yeah, I mean, we try to see everyone once a year because everyone should get a skin cancer screening. Some people that have a skin cancer history, we'll see them every 3 months or every 6 months.
So any kind of acne and things of that sort. As someone that wants to get involved in that, what's the type of person? You were saying that this was something that intrigued you and you were interested in. Is that what a lot of students are doing when they go to college and going to that field?
I mean, I think people pursue what they're interested in. So if they're interested in becoming a doctor, I mean, I would advise people to become a doctor first and then go to medical school and learn the different fields, try to see what's out there, all from cardiology to endocrinology, to surgery to dermatology. And once they have exposure, then they can decide what their area of specialty will be.
Gotcha. Now we're coming to the end of our show, and usually I ask my guests, what advice do you want to give to the parents and the students that are watching this in high school? What advice do you want to give them?
I would say, I guess I don't have a set speech on that, but in general, be prepared to work extremely hard for many, many years. I would say life is a marathon. And, if you ever run a marathon, you don't run full blast. You have to pace yourself. So have a balanced life, exercise, have fun, have friends, get sleep, take vacations. Don't kill yourself. Go at 3/4, half speed to 3/4, turn it up when you need to, but don't think about 100 miles ahead. Do 1 mile at a time, one day at a time, 1 week at a time, one semester at a time. Set your sights. Hey, this is where I want to go. I'm going to make some goals for the next 2 or 3 months. If you try to think about it all in one shot, it's like overwhelming. Even when I talk about it to you and I think back, I'm like, wow, that's a lot. How did I do that? But at the time, if you just stay excited, stay engaged, not worry about look what's the next month ahead. Don't overwhelm yourself, and just know that if you work hard in medicine, whether it's dermatology, medical school, or whether you're being a PA, particularly in healthcare, we're talking healthcare, right? There's always opportunity for anyone that's bright, hardworking, that wants to interface with people. At the end of the day, I'm helping people like crazy, and my patients want help. And if it's attractive to you to help people be, fairly paid, then any form of medical care is great to go into.
Great.
That
Well, thank you very much for coming on the show. I really appreciate it, Doctor.
bet.
All right.
Thank you.
So you have a great day, and I'll talk to you soon. You've been
Thank you.
watching The Secrets of College Planning. I'm your host, Anthony Uva. Until next time.